U.S. health insurance is largely divided into three categories: Medicaid and private insurance. For Medicaid, which serves low-income individuals, obesity drugs are covered in only about 15 to 20 states. Furthermore, a preemptive agreement was reached to supply oral versions of obesity drugs at a breakthrough price of $149 per month upon their release. In exchange for lower prices, these pharmaceutical companies received a 3-year waiver on drug tariffs. It defines obesity not as a personal failure but as a social disease, resulting from a combination of the processed food system, environmental factors, and genetic metabolic imbalances. The supply shortage, which has been the biggest obstacle to the distribution of obesity drugs, is expected to be largely resolved in 2026 with the completion of large-scale production facilities. more people are anticipated to access these treatments at lower prices. The Trump administration's Department of Health and Human Services is considering ways to strongly encourage state governments to include obesity treatment as a mandatory benefit in Medicaid or provide federal budget support. The number of states providing these benefits is expected to grow from the current 15 to 22 over 30 states by 2026. So, will South Korea apply national health insurance to obesity drugs as well? Unlike the US, where private insurance leads and companies compete once the government negotiates prices. South Korea operates under a single-payer national health insurance system. Currently, Korea's health insurance is facing warnings of deficits or depletion due to an aging population. The government is under significant pressure to prioritize funding for critical illnesses like cancer or rare diseases over obesity. Additionally, in the US, even if the government spends money on insurance for obesity drugs, the tax revenue and jobs generated by those factories return to the government. Since South Korea relies on imports, insurance payouts would flow entirely to foreign pharmaceutical companies, leaving little benefit for the domestic economy. Ultimately, for obesity drugs to become affordable in South Korea, there must be a shift, such as domestic pharmaceutical companies producing generic versions or multinational companies establishing production bases in Korea. For now, it is highly likely that discussions regarding health insurance benefits will be limited to patients with morbid obesity or those with severe comorbidities.